Our cardiovascular system is comprised of our beating heart, blood vessels, and blood. The average man's body contains 5 to 6 liters of whole blood. Blood has many life-sustaining responsibilities, including transporting oxygen, carbon dioxide, nutrients, and hormones throughout the body. Blood is composed of red blood cells, white blood cells, platelets, and nutrients. Also circulating in our blood is cholesterol. The two common forms are LDL, the bad cholesterol, and HDL, the good cholesterol. Hyperlipidemia occurs when we have a higher amount of LDL than is normal. LDL travels out of the blood and is deposited between the smooth muscle cells of the artery. White blood cells called macrophages eat the LDL and become foam cells. These cells eventually rupture and begin to form a lipid layer called plaque. The increase in lipids can cause plaque to grow over time, leading to obstructions. If the obstruction occurs in the coronary arteries, it could result in a heart attack. If the obstruction occurs in arteries in our brain, it could lead to a stroke. There are no symptoms, so screening for hyperlipidemia should be part of your regular physical examination.
The heart is the primary organ of the cardiovascular system. It is a beating muscle that supplies the body's cells with oxygen and nutrient-rich blood. The heart also requires these substances to function. The coronary arteries surrounding the heart keep it nourished with blood. Inside a healthy artery, red blood cells and other substances can flow freely to the heart. The walls of the artery are smooth and uniform in thickness. Over time, however, fatty deposits called plaque can build up within the artery walls. Plaque may harden and cause the artery to become narrow, a process called atherosclerosis. When atherosclerosis occurs in the coronary arteries, the condition is called coronary artery disease, or CAD. Untreated, coronary artery disease usually worsens and can lead to myocardial infarction, the medical term for heart attack. A heart attack occurs when a blockage in a coronary artery deprives the heart of blood. Most heart attacks are caused by blood clots that form in an area of unstable plaque. Plaque is considered unstable if its calcified cap is thin and vulnerable to rupture. A rupture exposes the fatty core to the bloodstream. The exposed core triggers the blood to coagulate or clump together, similar to the way blood clots at the site of a wound to stem bleeding. Inside an artery, a blood clot, called a thrombus, can block blood flow to the heart. Deprived of oxygen, heart tissue fed by the blocked artery will quickly die. The extent of damage sustained by the heart depends on the severity of the attack, speed of medical treatment, and the location of the blockage.
Our brain, like all organs within our body, needs oxygen and nutrients in order to function properly. These life-sustaining products are delivered in our blood through the circulatory system. A stroke occurs because there is a lack of blood to the brain. That could be caused by one of two things: either a ruptured blood vessel, like a brain aneurysm, or a small, free-floating clot or particle, known as an embolism, that is traveling through your blood and blocks one of the arteries to the brain. Depending on what areas of your brain are affected, stroke can cause speech impairments, paralysis in parts of your body, and unconsciousness. The heart is a beating muscle that continually pumps blood to the rest of the body. The coronary arteries supply the heart itself with the necessary oxygen and nutrients it needs to function effectively. Over time, fatty deposits called plaque can build up inside the arteries, clogging the passages and reducing the flow of blood to the heart. A coronary angiogram uses contrast dye to determine if the heart is getting an adequate supply of blood.
A catheter delivers the dye to the coronary arteries. A small incision is made in the upper thigh. A guide wire is then inserted into the femoral artery and threaded to the aorta. A catheter is inserted along the guide wire to the aorta. Once the catheter reaches the aorta, the contrast dye is injected and an X-ray is performed. Areas of healthy blood flow appear light in the X-ray. Following the angiogram, the catheter and guide wire are withdrawn. If treatment is necessary, your physician may recommend medication therapy or one or more commonly performed procedures, such as balloon angioplasty, stenting, atherectomy, or bypass surgery.